State lawmakers recently passed legislation to protect student athletes from concussions.
A neurocognitive assessment called ImPACT helps coaches, trainers, and healthcare providers determine an athlete's ability to return to play after suffering a concussion. News 12's Brittany Larson has more.
No one can argue football is a contact sport. And that's exactly why Maple River Junior Trevor Lejold enjoys it.
Hit the player in front of you and not get in trouble for it.
But it's not uncommon for a sport like football to lead to some serious injuries, including concussions. That's what happened to Trevor 2 weeks ago during practice.
Coach asked me what was wrong because I kept pushing on my temple, trying to get away with the pain because it helped a little bit. He said just sit out for a little bit.
Now state law requires what's called an impact assessment for student athletes before and after they have suffered a head injury.
Test your memory, basically what it does a lot. It'll show you 10 words and then you got to recite it and they'll tell you, ask, well, is this one of the words? And you got to say yes or no.
So this isn't a test of answering right or wrong, but rather measures your cognitive ability and the test taker's response time to determine if there's any problems where that athlete shouldn't participate in any physical activity.
That can show that you have neurocognitive problems even though you may be asymptomatic. It also prevents students from telling the coach that he is okay when he is not okay.
The Mankato Clinic Foundation provides funding for ImPACT to several area high schools, so athletes like Trevor can get back on the field when they're ready.
Well, if you play scared, if you go slow, it's just, you're not going to be prepared when the guy's going full speed and hits you.
Brittany Larson, News 12.